who is from Columbia, South Carolina, an industrial engineering major. Her speech tonight is simply nutrition.
That's about 3 pounds of sugar. Now, if I asked you how long you think it takes to put that much sugar in your body, what would you say? Some of you might say, well, I like cake and cookies and sweet tea. It's going to take me about a month. But some of you are probably saying, I try and avoid sugar. It's going to take me a lot longer than that. But what if I told you that according to a study done by the New Hampshire Department of Health and Human Services, done back in July 2012, called How Much Sugar Do You Eat? Based on your average college diet, it only takes you a week to put that much amount of sugar in your body. But why would you know that? Our education system has never put any importance on nutrition before. But for some reason, Clemson University has put importance on learning how to reserve a book. Or they're handing us a book and saying, write an essay on this. I'm talking about Library 100, or more recently known as CU 1000. We all took it, we all know what it was like. A bit of a waste of our times. And I can attest that because I'm a librarian in the Tillman Media Center. Most of you probably didn't even know there was a library in Tillman, which is exactly my point. I have people coming in every day asking me how to reserve a book or what resources are available to us. And I can also attest to how important nutrition is. Last year, just by changing my diet, not even implementing exercise, I lost about 30 pounds in 5 months. So now, today, let's look at why we have poor nutrition, how it's affecting us now, how it's going to keep affecting us, and what we can do to fix it. So let's first look at why we even have poor nutrition. We don't necessarily have poor nutrition by choice, but by lack of knowledge. We haven't learned these skills from an early age. In the publication called Nutrition Education in Public Elementary and Secondary Schools in the National Center for Education Statistics, taken in July 1996, nutrition was only 10% of the health curriculum. Think about that for a second. 10% of every one health class you took, maybe once every 9 weeks. That's a pretty small margin. But we know it's important. We have people like Michelle Obama endorsing this. The former Miss South Carolina of 2011 Free Voice, her entire platform was on eating healthy and fighting obesity in children. In the Journal of the American Dietetic Association, Dr. Briggs found in November 2010 that nutrition programs are now required in 27% of schools, elementary schools even. But in 2010, when that study was taken, everybody in this room was already at least in high school. So how are we going to benefit from that? We can't, but it's affecting us now. So let's look at how it's going to keep affecting us currently and later on. College obesity is on the rise, according to Decide, Miller, Staples, and Bravender in risk factors associated with overweight and obesity in college students in 2008. And we can feel it. Every time you go to Taco Bell or Cookout and you eat it, you feel a little tired, a little sluggish later, and that starts to add on. But we're already tired from our college workload. We don't need to be adding on by what we're eating, right? And we have high metabolisms. As late teens and people in our early 20s, we don't see the pounds that we're starting to pack on. We don't see that later on it's going to keep affecting us. So let's look at that. Let's look at how our nutrition is affecting us 10, 20, even 30 years from now. Take a moment and think about your parents, your older relatives, your aunts, uncles, maybe your bosses, and you see them, and some of them are not exactly slim. But you see pictures of them when they were our age, and you're thinking to yourself, whoa, what happened? Chances are is that they continued their poor nutritional habits, which can actually be dangerous. Pollack and Colditz in life years lost associated with obesity-related diseases for adults showed that poor nutrition puts you at risk for endometrial cancer, breast cancer, strokes, and your life expectancy decreases by 7.5%. Those are years of your life gone. And so at this point, we need to realize it's not just about looking good in our 20s. It's about feeling good in our 50s. And before some of you start saying, well, these are my choices. What I'm eating is only affecting me, so it shouldn't matter, let's not get too carried away. Some of us should consider our future families. Sinclair and Watkins wrote Parental Diet, Pregnancy Outcomes in Offspring in Reproduction, Fertility, and Development. and discuss that 50%, that's half of a child's metabolism, is already predetermined and directly correlated with both parents' diets, not only during, but before pregnancy. So what can we do to make sure that our children, that we haven't even thought about having yet, don't suffer from our poor nutritional choices? So let's look at the solution and how we fix this. We fix it by learning, because that's exactly what we're here for. We take control and get rid of information that we're not going to need 4 years from now, or information that we already know. We don't need to attend drunk driving seminars, because we already know drunk driving is bad. And we have people like me, a librarian, whose job it is to show us what resources we have available to us. But whose job is it to teach you these lifelong skills that you're going to need later on? So let's ask Clemson to hand us the tools that we need to be healthy, because nobody has ever even offered them to us yet. And let's take it a step further. Let's not only learn what to eat, but how to eat it, how to prepare the food, how to use portion control, to how to understand nutrition labels and what serving sizes really mean. So now that we've covered why we have poor nutrition, how it's affecting us now, how it's going to keep affecting us, and what the solution is, what can you do? You can start to spread the word and realize how important nutrition is. The next time you go to Harkema or Schletter and you grab a burger, think about what you're putting in your body. And I'm not talking about the buns or the meat. I'm talking about the fat, the grease, the sodium. Or next time you're at the store, grab your favorite snack off the shelf. Read the ingredients. Do you know what they are? Can you even pronounce them? And through realizing that this nutrition issue is actually an issue, we can bring it to the forefront. And Clemson University will realize that they should change Library 100 into a nutrition program. So let's stop assuming that all salads are healthy and that all pizza isn't, because that's not the case. Let's stop throwing away years of our lives because we don't necessarily know what's best for our body, the most important tool we have in life. Let's stop wasting our college years, the best years we have in our lives, on skills that we'll never need again, and let's stop putting 3 pounds of sugar into our body week after week. Thank you.